Thanks for joining us. I'm Dan Holscher with Senior Mark, and today I'm going to start our four-part series on the traditional Medicare system. We're going to discuss the four parts very briefly, and then today we're going to focus on the traditional Medicare system, which is Part A and Part B of Medicare. So the four parts being Part A and Part B, those two make up the traditional Medicare system. Part A is the hospital insurance, which consists of anything that's inpatient hospital. Part B of Medicare covers the medical insurance, which is everything outside of the hospital. Now, Part A and B are the traditional Medicare system. There is an alternative to traditional Medicare, which is Part C of Medicare, the Medicare Advantage program, and that is an alternative. So you won't have A and B and C. You will have A and B, or you'll choose C. And we'll have another video that explains the differences between those two and the positives and negatives of each. And then we move on to Part D of Medicare, which is the prescription drug plan. Now, focusing first on Part A of Medicare, the traditional Medicare system consists of Part A and Part B of Medicare, and that's what most people are thinking of when they think of Medicare. And it's the red, white, and blue Medicare card that you get when you first turn 65 or first enroll in Medicare. So, starting with Part A of Medicare, the hospital insurance. The hospital insurance covers inpatient care in hospitals. It covers inpatient care in a skilled nursing facility. It covers home health and hospice care. And one thing to remember, and this is sometimes misunderstood by people, Medicare does not cover long-term care facilities. They don't cover that. What long-term care is custodial care where you can't take care of yourself anymore and you need to go into a long-term care facility. So Medicare does not cover that. Now, when it comes to hospitalization, for the first 60 days in the hospital, Medicare is going to pay everything except for a $1,156 deductible. That's called your Part A deductible. Now, whether you're in the hospital for 1 day or 60 days, you still have to pay that $1,156. Now, that deductible is not a calendar year deductible like most people are used to. It can repeat within the year. So it resets once you've been out of the hospital for 60 consecutive days. So in a perfect storm, you could have to meet that deductible up to 6 times in 1 year. Now, if you ever get to the 61st through the 90th day, Medicare is going to pay everything except for a $289 per day coinsurance, and that would be your responsibility. If you ever get to the 91st day and after, Medicare is going to pay everything except for a $578 per day coinsurance, which is also your responsibility. Now, once you get to the 91st day, you start using up your 60 lifetime reserve days. Those are days that once you use a day, you lose it. And if you ever get past those, if you ever use up all 60 of those lifetime reserve days, Medicare drops off and you are no longer covered. Now, when it comes to skilled nursing facility, Medicare will pay the first 20 days that you're in a skilled nursing facility, and they will pay the full amount of the Medicare approved charges. If you get to the 21st through the 100th day, Medicare is going to pay everything except for a $144.50 per day coinsurance, and that's your responsibility. So you have a total of 100 days of coverage. The last 80 days you have to pay that daily copay amount. Now, this benefit also resets. So if you used up your 100 days for the year, once you were out for 60 consecutive days, you could start back over at day 1 again. Now, when it comes to hospice care, Medicare does a great job at covering hospice. They will pay everything except for maybe a limited coinsurance for outpatient drugs or inpatient respite care. But for the most part, you won't have any issues when it comes to hospice care. Now moving on to Part B of Medicare, and we discussed that's everything outside of the hospital. So it covers things such as physician services, outpatient surgery and services and supplies, physical and speech therapy, diagnostic testing, durable medical equipment, blood transfusions. General rule of thumb, if it's outside of the hospital, it'll probably be covered under Part B. Now when it comes to Part B services, you're responsible for the first $140 per year of expenses. That's called your Part B deductible. Once you've met that deductible for the year, Medicare starts paying 80% of your expenses. you're responsible for the other 20%. Now, one thing to keep in mind, most people are used to an annual out-of-pocket limit with their health insurance. Medicare does not have that. So whatever your 20% of the charges, responsibility, if that's yours, whatever the hospital charges that are passed on to you, if that's a $20,000 bill or a $25,000 bill, you're responsible for the full amount because there is no annual cap with Medicare. Now, another thing that you'll need to consider are what are called excess charges. What an excess charge is when a provider charges more than the Medicare approved amount. Now, in Ohio, providers have to accept the Medicare approved amount. That's state law. They cannot balance bill you the difference. There are 6 states that are like Ohio, but outside of Ohio, all those other states, they can choose to charge you up to 15% more than Medicare approves. That's considered an excess charge, and if that would ever come up for you, you would be responsible for that additional charge. When it comes to blood transfusions follow the same $140 deductible and then 80/20, just like all other Part B services. The only difference is Medicare has what they call a blood deductible. So the first 3 pints of blood you would receive, you would pay the full amount for that. The rest would fall under the $140 deductible and 80/20 after that. So that covers our discussion about traditional Medicare. If you have more questions or you'd like more information or to schedule a free consultation, I'd be more than happy to meet with you or talk to you. You can reach me toll free at 877-492-8803, or you can email me directly at dan@seniormark.com. Thanks for joining us and have a great day.